Welcome to Pediatric Case Review. Today's lecture provides a comprehensive overview of cerebral palsy from medical professionals. We'll cover diagnosis, clinical assessment, and management strategies to enhance your clinical practice with these patients. A 12-month-old infant is brought to clinic with concerns about development. Which finding is most suggestive of cerebral palsy? A. Persistent primitive reflexes beyond expected age. B. Delayed speech development only. C. Frequent ear infections. D. Failure to gain weight. The correct answer is A. Persistent primitive reflexes beyond expected age. Primitive reflexes like the Moro reflex and asymmetric tonic neck reflex should disappear by 4 to 6 months. Their persistence suggests abnormal neurological development, which is a hallmark of cerebral palsy, often accompanied by delayed motor milestones and abnormal muscle tone. A 2-year-old boy presents with toe walking, scissoring gait, and increased muscle tone in both legs. Which type of cerebral palsy does this most likely represent? A. Spastic diplegia. B. Dyskinetic cerebral palsy. C. Ataxic cerebral palsy. D. Spastic hemiplegia. The correct answer is A. Spastic diplegia. This form of cerebral palsy primarily affects the lower limbs with increased muscle tone and spasticity. The classic presentation includes toe walking, scissoring of the legs during ambulation, and increased tone in both legs. This pattern is particularly common in premature infants with periventricular leukomalacia. A 3-year-old child presents with involuntary writhing movements, facial grimacing, and fluctuating muscle tone. Which cerebral palsy subtype is most likely? A. Athetoid cerebral palsy. B. Spastic quadriplegia. C. Ataxic cerebral palsy. D. Mixed cerebral palsy. The correct answer is A. Athetoid cerebral palsy, also known as dyskinetic cerebral palsy. This subtype is characterized by involuntary, writhing movements, facial grimacing, and fluctuating muscle tone that varies between hypotonia and hypertonia. It often results from basal ganglia injury and has historical association with kernicterus from severe hyperbilirubinemia. During examination of a 2-year-old with suspected cerebral palsy, which finding would be most important to document? A. Muscle tone abnormalities. B. Head circumference. C. Visual acuity. D. Hearing assessment. The correct answer is A. Muscle tone abnormalities. Cerebral palsy is defined as a group of permanent disorders affecting movement and posture due to non-progressive disturbances in the developing brain. Assessing and documenting the pattern, distribution, and quality of tone abnormalities is fundamental to diagnosis and classification of cerebral palsy. While the other assessments are important, tone evaluation is central. Which clinical test is most appropriate for evaluating spasticity in a child with cerebral palsy? A. Modified Ashworth scale. B. Glasgow Coma scale. C. APGAR score. D. Babinski test. The correct answer is A. The Modified Ashworth scale. This is a standardized clinical tool for assessing muscle tone and spasticity in patients with cerebral palsy. The scale ranges from 0, indicating normal muscle tone, to 4, indicating rigid limbs. It helps clinicians document baseline spasticity and monitor response to interventions like botulinum toxin, oral medications, or surgery. Which classification system is most useful for describing gross motor function in children with cerebral palsy? A. Gross motor function classification system. B. Manual ability classification system. C. Pediatric Glasgow Coma scale. D. APGAR score. The correct answer is A. The gross motor function classification system, or GMFCS. This is a 5-level classification system based on self-initiated movement with emphasis on sitting, transfers, and mobility. Level 1 represents the highest function, while Level 5 represents the most limited function. The GMFCS is crucial for prognostication, treatment planning, and research in cerebral palsy. Which of the following is the most common cause of cerebral palsy in full-term infants? A. Hypoxic ischemic encephalopathy. B. Genetic mutations. C. Maternal infection. D. Postnatal trauma. The correct answer is A. Hypoxic ischemic encephalopathy. In full-term infants, perinatal asphyxia leading to hypoxic ischemic encephalopathy is the most common cause of cerebral palsy. This oxygen deprivation damages vulnerable areas like the basal ganglia and motor cortex. While genetic factors, maternal infections, and postnatal causes contribute to cerebral palsy, hypoxic ischemic injury remains predominant in term infants. In preterm infants, which pathological finding is most commonly associated with spastic diplegia cerebral palsy? A. Periventricular leukomalacia. B. Germinal matrix hemorrhage. C. Cortical dysplasia. D. Cerebellar hypoplasia. The correct answer is A. periventricular leukomalacia, or PVL. This white matter injury is particularly common in premature infants and selectively damages motor fibers that control the lower extremities as they descend through the periventricular region. This pattern of injury explains why many premature infants develop spastic diplegia, where leg involvement is more severe than arm involvement. Which neuroimaging finding would be most consistent with spastic quadriplegic cerebral palsy in a term infant? A. Multicystic encephalomalacia. B. Isolated periventricular leukomalacia. C. Normal brain MRI. D. Isolated cerebellar hypoplasia. The correct answer is A. Multicystic encephalomalacia. This finding represents widespread brain injury following a severe hypoxic ischemic insult and correlates with spastic quadriplegia, the most severe form of cerebral palsy affecting all four limbs. Periventricular leukomalacia typically causes diplegia. Normal MRI is uncommon in severe CP, and isolated cerebellar hypoplasia usually causes ataxic CP. A 9-month-old with developmental delay and increased tone should undergo which of the following as part of the initial diagnostic workup? A. Brain MRI. B. Muscle biopsy. C. Genetic testing for muscular dystrophy. D. Cerebrospinal fluid analysis. The correct answer is A. Brain MRI. Magnetic resonance imaging is the first-line investigation for children with suspected cerebral palsy, as it can identify structural abnormalities and patterns of injury that help confirm the diagnosis and determine etiology. MRI can reveal the timing and nature of the brain injury, which helps guide further management. The other tests may be considered based on clinical findings, but are not routine first-line investigations. A 4-year-old with spastic diplegic cerebral palsy has increasing toe walking despite physical therapy. Which treatment would be most appropriate to consider next? A. Botulinum toxin injections. B. Selective dorsal rhizotomy. C. Immediate tendon lengthening surgery. D. Constraint-induced movement therapy. The correct answer is A. Botulinum toxin injections. In a child with persistent toe walking despite physical therapy, botulinum toxin injections are typically the next step. This less invasive approach temporarily reduces spasticity by blocking acetylcholine release at the neuromuscular junction. Surgical options like dorsal rhizotomy or tendon lengthening are generally reserved for when less invasive treatments fail. Constraint therapy targets upper limb function. Which oral medication is commonly used as first-line treatment for generalized spasticity in cerebral palsy? A. Baclofen. B. Morphine. C. Phenobarbital. D. Methylphenidate. The correct answer is A. Baclofen. This medication acts as a GABA-B receptor agonist that reduces muscle tone by decreasing excitatory neurotransmitter release at the spinal level. Baclofen is typically the first-line oral medication for managing generalized spasticity in cerebral palsy. For severe cases unresponsive to oral therapy, intrathecal baclofen delivered via pump may be considered. The other medications listed are not indicated for spasticity management. A 6-year-old with cerebral palsy has difficulty with self-feeding. Which specialist would be most appropriate to address this specific concern? A. Occupational therapist. B. Speech-language pathologist. C. Orthopedic surgeon. D. Neurologist. The correct answer is A. Occupational therapist. Occupational therapists specialize in improving activities of daily living, including self-feeding skills. They can assess the child's upper extremity function, provide adaptive equipment like specialized utensils, and develop strategies to enhance independence with meals. While speech therapists address swallowing and oral motor issues, neurologists manage medical aspects, and orthopedic surgeons address skeletal deformities, the occupational therapist is most appropriate for self-feeding concerns. Which of the following comorbidities is most common in children with cerebral palsy? A. Epilepsy. B. Diabetes mellitus. C. Asthma. D. Congenital heart disease. The correct answer is A. Epilepsy. Seizure disorders affect approximately 25 to 45% of children with cerebral palsy, making it one of the most common comorbidities. Epilepsy is particularly prevalent in children with spastic quadriplegia and those with significant structural brain abnormalities. Management often requires anticonvulsant medications and regular neurological follow-up, as seizure types and frequency may change over time. A 10-year-old with spastic quadriplegic cerebral palsy is non-ambulatory and has developed painful hip displacement. What is the most concerning potential complication? A. Hip dislocation and windswept deformity. B. Transient joint pain. C. Patellofemoral syndrome. D. Tarsal tunnel syndrome. The correct answer is A. Hip dislocation and windswept deformity. In non-ambulatory children with spastic quadriplegia, Progressive hip displacement often leads to complete dislocation if untreated. This causes significant pain, difficulty with positioning, hygiene challenges, and eventually windswept deformity where both legs deviate to one side. Early detection through hip surveillance programs and timely intervention is crucial to prevent these serious complications. Thank you for joining us for this comprehensive overview of cerebral palsy. Remember that early diagnosis, multidisciplinary management, and attention to associated complications are key to optimizing outcomes. Please follow Pediatric Case Review for more informative presentations on pediatric topics. If you have any questions, please leave them in the comments section below. We appreciate your attention and look forward to seeing you in our next educational video.